Hi, it's me, Dr. Phane. I'm here to talk about the ITero today for our Tooth Talk Tuesday. So the ITero is a scanning machine. It creates a 3D model of your tooth that you can move around. We can take a look, and there's actually a lot of functions on here that we can use to diagnose certain things that are going on with your bite. So let's take a look. Okay, so this is the ITero scanner. It is a little computer on wheels, and we roll it into your room if you need a scan. This is the little head on it that goes into your mouth. It's a little camera that just kind of scans your teeth. As it's scanning, it creates this really cool 3D image of your teeth. Kind of, you know, you can see views that you've never seen before. You know, this is what your tongue sees when you're biting. Okay, anyway, so there's also a lot of different functions that we can use. The one function that I thought was really cool to talk about today is the function that kind of shows where you bite and how hard you can bite on your teeth here. So I'm gonna bring up this little, kind of like a typography little map thing. But what we're looking at is we're looking at how hard your teeth come together. And if we look really closely, you can see these two little red dots over here. On this particular patient, it looks like she's biting really hard on these two teeth. And not only on just these two teeth, but on the slope of them. Because usually when we bite, we want to bite right here, right in the dead center of the tooth. That's where the tooth is made to take on all the weight, either right here or right here on the tips. If we bite on the slope, kind of like, you know, a little mountain slope, you can see she's also biting on the slope here, not on the tip. What happens is you can actually see, it's kind of hard to see in color, but you can see these things, these two little notches right here by your gum line where you can, if you were to take your fingernail, you could probably fit your fingernail in there and kind of hear it go click, click. That is called an infraction. Infractions happen because when we bite down on our teeth, the neck of the tooth is the part that wiggles. And the part that wiggles is the part that the enamel actually fractures off of, and you get an abfraction. If I turn it into a one color model here, you can really see the shadows that are happening right here. So what happens is you bite down, you have a disruptive, a harmful bite, you bite here, and instead of the tooth, you know, hitting straight down the axis of the tooth down in the center, it hits on the slope and it makes it bend like this. So this tooth is bending like that, and it's causing a break right here and right here because of the bend on it. We utilize this to kind of let us know, okay, well, when we do Invisalign, we have to move that tooth into the proper occlusion to make sure that your teeth are hitting where they're supposed to be hitting. And so when we bring this together, we can see that these two teeth here, you can see, lo and behold, another abfraction right there. And then another one on this tooth here. So this area right here is what we call traumatic occlusion. And even though it looks perfectly normal and perfectly fine right there, it shouldn't be hitting there. So the ITero is a really cool system, a little cool computer system to kind of show us all the crazy things that are happening with your mouth, with your bite. You can zoom in, zoom out, flip your bite around, and just really take a look at things in a way that you've never seen before. And that is the ITero.